In many cases, the way we look at how effective providers are in delivering care is based on what researchers and clinicians think. It does not include the patient viewpoint. The goal of the Robert Wood Johnson Foundation grant was to really understand how patients look at good care. We worked with a very large group of people from our Patients Like Me online community and another very innovative community-based health center, St. Matthew's Outreach, to interview patients. Patients Like Me is a community of people with chronic diseases. It's a very broad community, so that gives us access to a lot of different opinions about what good care is.
People need to educate themselves to the extent that they're more likely to get care that conforms with what they actually want. It's not enough to say that you want the best outcome. You actually have to define what that outcome is.
But it is also important to really go out into a community situation to see what others think. We asked patients to simply give us a list of what they thought represented good care. We were able to boil that down using what's called concept mapping into 10 basic concepts. These included things like an active patient role, working with a competent professional, how the professional worked in collaboration with the patient, was care individualized, and also how the relationships with the rest of the treatment team and even the office staff took place. We know that people who don't feel these things might have a greater likelihood of not complying with the treatment, following the recommendations.
Good care to me is someone providing me the information I need to know to better myself or possibly stay around long. It's important that who I go to is for my best interest.
I think there's a lot of individual ways that people can apply this information. Really look at some of the factors that we found here. You certainly want to see, number one, does the treatment work? Do you understand how the treatment is delivered, what you're supposed to be doing? Are you playing an active role in it, or does it feel like you're just kind of flowing with the recommendations that are being given to you? Do you feel like you have a partner in the doctor, a teacher? Is it a relationship that feels like it's uneven? Now more than ever, we need to really pay attention to that patient role.